I can report through the government's ongoing monitoring and testing programme that as of 9 a.m. today, there have been 974,000 tests carried out across the UK, excluding Northern Ireland. Of these, 78,991 people have tested positive. 20,101 patients are currently hospital in Great Britain who have already tested positive. Sadly, 9,875 people have now died, an increase of 917 on yesterday. As this virus continues to devastate families across our nation, my thoughts, prayers and heartfelt condolences are with their friends, their families and their loved ones. To everybody suffering from this horrific virus, whether you are at home or receiving care from our brilliant NHS in hospital, you are in all our thoughts at this devastating time. And I'm very pleased to say that the Prime Minister continues to make good progress. But these stark figures highlight the gravity of this national emergency, the devastating impact of this virus and the unprecedented but necessary action that we are taking to tackle it is affecting every aspect of our daily lives. This virus is also changing the nature of the threat that we face from crime. Martin and myself today will update you on the emerging crime picture and the extra work that the government, along with law enforcement partners, is undertaking to better protect victims. And Martin will set out that total crime has dropped as people follow the necessary advice to stay at home. I'm now asking this nation to use that amazing compassion and community spirit to embrace those who are trapped in the horrific cycle of abuse. To help us all look out for those who need help, we have created a new campaign, and we have created a symbol of hope, a handprint embossed with a heart, so that people can easily show that we will not tolerate abuse as a society.
There are now calls to sue China for giving the world this coronavirus that has killed 70,000 people so far and absolutely paralysed the world economy. And China does have questions to answer. They're not just the questions I've raised several times before, like why did China wait weeks to tell the world about this new virus? Why did it punish local scientists who did try to warn us? And now there's something else. The general theory is that this virus comes from a species of bat jumping over to humans, and that it all started in the seafood market at Wuhan, where wild animals are also kept and killed. But that theory is now looking very shaky. For a start, a scholar from the South China University of Technology recently published a paper saying, wait a minute, according to municipal reports and testimonies from 31 residents and 28 visitors, the bat was never a food source in Wuhan and was not sold in that market. In fact, the Lancet study confirmed that the first person to get sick had no connection with the market at all, although many, of course, later did. Now, this scholar, who used to be a postdoctoral research fellow at Harvard Medical School, no fool, said maybe the virus came accidentally from researchers in Wuhan who'd been working on bat viruses. He said one such researcher at a nearby laboratory, just 300 metres from the market, reported that he'd been splashed with bat blood and urine while researching coronaviruses, although not necessarily this COVID-19, we don't know. And he was quarantined for 14 days. But this scholar who wrote about all this has since told the Wall Street Journal he's withdrawn his paper because he had no direct proofs. But you can imagine what pressure China might have put him under to shut up. And there's more. That bat researcher who got splashed is virologist Qian Zhanghua, who works at the Wuhan Center for Disease Control near the market and has collected bats for virus research. Now, promotional video on him suggests that it sometimes involved poor protection. But there is also another virus laboratory a bit further away from the market, which also worked on bat viruses. Now, this government laboratory even advertised twice last year, and I'm showing you a Google translation, for people to come work on new bat and rodent viruses it had discovered, and to do research on bats and coronaviruses related to SARS, which this laboratory traced back to bats a decade ago. I should make clear that this research is most likely about preventing illness, not causing it. And when the news broke out that Wuhan suddenly had a strange new virus erupting there, the head of this government laboratory in Wuhan, Shi Zhengli, was called in to investigate. The Scientific American reports, if coronaviruses were the culprit, she remembers thinking, could they have come from our lab? Well, later she posted on WeChat, I swear with my life, the virus has nothing to do with the lab. And I have no reason to say she's wrong. Unfortunately, I also have no reason to say she's right. I don't know. And China is not the kind of country that would welcome a confession that one of its own laboratories was to blame for all this death and destruction. So, who knows if we'll ever get to the truth? But we must keep asking questions of China. And if that takes a lawsuit, why not?
Social distancing is more relaxed in Sweden. Much of Europe has gone into lockdown in the face of the coronavirus's relentless spread. But in the spring sunshine, Stockholm's cafes have customers. The schools are open, and the Prime Minister has urged people not to panic.
We hope that they are doing the right thing. I think that, we Swedes normally we are better at social distancing in the first place. So it just feels that we are continuing living the way that we normally do as well.
It's about saving the restaurants. It's about saving the pubs. It's about saving people's work. Maybe we have found a good balance, but let's see when it's over.
The elderly have been told to avoid social contact. Crowds of more than 50 banned, but otherwise people are largely free to go about their normal lives. This is how life might have been in Britain too, but then came that computer simulation by Imperial College London that showed that hospitals were about to be overwhelmed, 250,000 people could die, and the country locked down. But here in Sweden, the authorities just don't believe that research. The doctor in charge of the strategy has been charting the upward curve in deaths, but he insists the simulation was based on assumptions and poor data.
I mean, compared to us, it's hugely pessimistic. And I don't think any curve in any country has gone that bad as the Imperial College says it's going to be. And I don't think there is no real connection between having a lot of lockdowns, closing borders, closing schools and so on, and being safer.
Some scientists are horrified by the risk they believe the authorities are taking. Many lives could be lost.
I'm a scientist. I don't trust authorities. I trust data, and I don't see transparency of data that makes me calm to say that the strategy chosen is the best way forward.
But they might be right.
They might be right, and I will open a champagne bottle then. Because this is not about me and who's right or wrong. I think that we should have an open discussion about the scientific data.
The authorities are building a field hospital just in case.
So this is one of the wards then?
That's correct. This is one of possible 60 wards. In every ward it will be 10 beds.
The first patients are expected as soon as Monday.
You work with Médecins Sans Frontières, Doctors Without Borders. Yeah. Did you ever imagine you'd be building a hospital like this in your home country?
Never, but I'm sure nobody anticipated what we're seeing now in all levels of society.
Sweden is hoping to let the virus spread slowly, an aim Britain once shared. Now the UK is trying to completely shut it down. There's no way of knowing which strategy will save more lives in the long run.
In New York City,
Sky News, Stockholm.
Hispanics represent the majority of deaths. In Milwaukee County, blacks are 25% of the population, but almost 50% of the cases and 75% of the deaths. So what's going on? Well, it's alarming, but it's not surprising that people of color have a greater burden of chronic health conditions. African Americans and Native Americans, develop high blood pressure at much younger ages. It's less likely to be under control and does greater harm to their organs. Puerto Ricans have higher rates of asthma, and black boys are 3 times as likely to die of asthma as their white counterparts. As a matter of fact, I've been carrying around an inhaler in my pocket for 40 years out of fear of having a fatal asthma attack. And I hope that showing you this inhaler shows little kids with asthma all across the country that they can grow up to be Surgeon General one day. The chronic burden of medical ills is likely to make people of color, especially, less resilient to the ravages of COVID-19, and is possibly, in fact likely, that the burden of social ills is also contributing. But let me be crystal clear. We do not think people of color are biologically or genetically predisposed to get COVID-19. There is nothing inherently wrong with you. But they are socially predisposed to coronavirus exposure and to have a higher incidence of the very diseases that put you at risk for severe complications of coronavirus. Stay at home if possible. If you must go out, maintain 6 feet of distance between you and everyone else, and wear a mask if you're going to be within 6 feet of others. Wash your hands more often than you ever dreamed possible. Avoid alcohol, tobacco, and drugs. And call your friends and family. Check in on your mother. She wants to hear from you right now. And speaking of mothers, we need you to do this, if not for yourself, then for your abuela. Do it for your granddaddy. Do it for your big mama. Do it for your pop-pop. We need you to understand, especially in communities of color, we need you to step up and help stop the spread so that we can protect those who are most vulnerable.
Many religions have festivals which celebrate light overcoming darkness. Such occasions are often accompanied by the lighting of candles. These seem to speak to every culture and appeal to people of all faiths and of none. They are lit on birthday cakes and to mark family anniversaries, when we gather happily around a source of light. It unites us. As darkness falls on the Saturday before Easter Day, many Christians would normally light candles together. In church, one light would pass to another, spreading slowly and then more rapidly as more candles are lit. It's a way of showing how the good news of Christ's resurrection has been passed on from the first Easter by every generation until now. This year, Easter will be different for many of us, but by keeping apart, we keep others safe. But Easter isn't cancelled. Indeed, we need Easter as much as ever. The discovery of the risen Christ on the first Easter day gave his followers new hope and fresh purpose, and we can all take heart from this. We know that coronavirus will not overcome us. As dark as death can be, particularly for those suffering with grief, light and life are greater. May the living flame of the Easter hope be a steady guide as we face the future. I wish everyone of all faiths and denominations a blessed Easter. I'm speaking to you at what I know is an increasingly challenging time. A time of disruption in the life of our country. A disruption that has brought grief to some, financial difficulties to many, and enormous changes to the daily lives of us all. I want to thank everyone on the NHS frontline, as well as care workers and those carrying out essential roles, who selflessly continue their day-to-day duties outside the home in support of us all. I'm sure the nation will join me in assuring you that what you do is appreciated, and every hour of your hard work brings us closer to a return to more normal times. I also want to thank those of you who are staying at home, thereby helping to protect the vulnerable and sparing many families the pain already felt by those who have lost loved ones. Together we are tackling this disease, and I want to reassure you that if we remain united and resolute, then we will overcome it. I hope in the years to come, everyone will be able to take pride in how they responded to this challenge. And those who come after us will say the Britons of this generation were as strong as any, that the attributes of self-discipline, of quiet, good-humoured resolve, and of fellow feeling still characterize this country. The pride in who we are is not a part of our past. It defines our present and our future. The moments when the United Kingdom has come together to applaud its care and essential workers will be remembered as an expression of our national spirit, and its symbol will be the rainbows drawn by children. Across the Commonwealth and around the world, we have seen heartwarming stories of people coming together to help others, be it through delivering food parcels and medicines, checking on neighbours, or converting businesses to help the relief effort. And though self-isolating may at times be hard, many people of all faiths and of none are discovering that it presents an opportunity to slow down, pause and reflect in prayer or meditation. It reminds me of the very first broadcast I made in 1940, helped by my sister. We as children spoke from here at Windsor to children who had been evacuated from their homes and sent away for their own safety. Today, once again, many will feel a painful sense of separation from their loved ones. But now as then, we know deep down that it is the right thing to do. While we have faced challenges before, this one is different. This time we join with all nations across the globe in a common endeavour, using the great advances of science and our instinctive compassion to heal. We will succeed, and that success will belong to every one of us. We should take comfort that while we may have more still to endure, better days will return. We will be with our friends again. We will be with our families again. We will meet again. But for now, I send my thanks and warmest good wishes to you all.